You may think that taking a shower is one of the safest and healthiest routines you can do. But the truth is that the way you shower, especially at night, can quietly raise your risk of a stroke. As a brain doctor, I have seen too many patients who went to bed after a shower feeling perfectly fine, only to wake up dizzy, confused, or even paralyzed on one side of their body. Some never woke up at all. What shocked their families is that the danger did not come from poor diet, smoking, or stress that night. It came from something as simple as the way they showered. Showering affects the body far more than most people realize. When water hits the skin, it does not only clean, it forces sudden changes in blood vessels, heart rate, and body temperature. A cold shower late at night can trigger rapid blood vessel constriction, raising blood pressure and straining the brain circulation. A hot shower, on the other hand, can cause excessive vessel dilation, lowering blood pressure and putting the heart under stress as it tries to keep circulation stable. Add the fact that at night your body is preparing to rest, your resistance is lower, and your brain is more vulnerable. And you can see why the wrong shower habit becomes so dangerous. The risk is especially high for older adults, seniors with hypertension, diabetes, or heart disease already live with fragile vessels that do not tolerate sudden shifts. Well, what seems like a refreshing shower before bed can become the trigger for a stroke or cardiac arrest. I have had patients tell me they felt lightheaded stepping out of the bathroom, brushed it off, and then collapsed minutes later. That is how fast and silent these risks can strike. This is why we must talk about shower habits. Most people focus on diet and exercise when thinking about stroke prevention, but they overlook daily routines like bathing, which directly influence circulation and blood pressure. In this video, I will reveal the 6 most dangerous shower habits that raise stroke risk overnight. You will learn why late-night cold showers, very hot showers before bed, showering immediately after meals, showering right after intense exercise, falling asleep with wet hair, and excessively long showers all create hidden dangers. I will also explain who is most at risk and how you can build safer habits to protect your brain and your heart. Before we begin, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. And if you find this video valuable, type 1 in the comments. If not, type 0 so I know how to improve. Remember, your body still remembers how to heal, but only if you give it the right conditions. Tonight, the way you shower could make the difference between waking up healthy or waking up with a life-changing condition. Part 1. The hidden danger of late-night cold showers. The first dangerous shower habit that you must know about is taking cold showers late at night. Many people believe that a cold shower before bed helps them relax, cool down, or sleep better. Some even use it as a way to wash off the fatigue of the day. But the reality is that cold showers taken at night can quietly increase your risk of stroke and heart problems, especially if you are older or already living with conditions like hypertension. Here is why. When cold water suddenly hits the skin, it triggers an immediate response in your body known as vasoconstriction. Blood vessels in the skin and throughout the body tighten rapidly in an attempt to conserve heat. This narrowing of vessels forces your blood pressure to rise, sometimes sharply, and the heart must work harder to keep circulation going. For a younger, healthy person, this might only cause temporary shivering or goosebumps. But for seniors with stiff arteries, high blood pressure, or fragile vessels. This sudden spike can become the trigger for a stroke or heart attack. Cold showers also activate the sympathetic nervous system, what doctors call the fight or flight response. This means your heart rate increases, stress hormones surge, and blood becomes more prone to clotting. Instead of preparing for rest, your body is pushed into a state of stress and alertness. For the brain, this is dangerous because blood flow becomes unstable and the risk of a clot lodging in a narrowed artery rises. Another hidden danger is thermal shock. At night, your body temperature naturally decreases as it prepares for sleep. A sudden cold shower disrupts this rhythm, shocking the system at its most vulnerable point. This can cause dizziness, lightheadedness, or even fainting when stepping out of the shower. Patients have reported collapsing in the bathroom after a cold shower, sometimes suffering injuries on top of the vascular risk. Research supports this concern. Studies show that sudden exposure to cold water can raise systolic blood pressure by 20 to 30 points in seconds. For a person already living with hypertension, this is enough to cross the threshold where small blood vessels in the brain rupture or clot formation is triggered. I have treated patients who admitted that they enjoyed the habit of a cold shower before bed, believing it made them feel strong or refreshed. But over time, they began experiencing frequent morning headaches, dizziness, or unexplained fatigue. These were warning signs of circulation strain during the night. Some eventually suffered minor strokes that could have been prevented by changing this habit. The solution is clear. Avoid cold showers late at night. If you prefer cooler water, use lukewarm temperatures and keep the shower short, especially in the evening. Save cold showers for the daytime when your body is more resilient and alert. The lesson here is simple. A cold shower may feel refreshing, but at night it is a silent danger to your heart and brain. If this shocked you, wait until you hear about the next dangerous habit, very hot showers before bed, which can also quietly raise your stroke risk overnight. Part 2. Hot showers before bed and the silent risk. While cold showers at night shock the system in one way, very hot showers create a completely different but equally dangerous problem. Many people enjoy stepping into a steaming hot shower before bed, especially during colder months, thinking it will relax their muscles and help them sleep more soundly. But as a brain doctor, I must warn you that this habit can quietly place serious stress on your heart and brain, raising your risk of stroke overnight. Here is what happens inside the body. When hot water hits your skin, your blood vessels dilate or widen in an attempt to release heat. This widening of vessels lowers blood pressure. And for some people, it can drop quite suddenly. While that may sound harmless, the brain depends on a constant and steady flow of oxygen, rich blood. If blood pressure falls too low, the brain does not receive enough oxygen, and this can trigger fainting, dizziness, or even a sudden collapse in the shower. For seniors who already have narrowed arteries or heart disease, the danger is magnified because the circulation cannot adjust quickly enough. There is another hidden risk. When you finish a hot shower and step into a cooler bedroom environment, your body undergoes a rapid temperature shift in the opposite direction. Blood vessels that were just dilated suddenly constrict again, creating a rebound effect that can cause unstable blood pressure swings. These fluctuations, from low to high pressure in minutes, place tremendous strain on both the heart and the blood vessels in the brain. It is during these unstable moments that a clot can form or a fragile vessel can rupture, leading to a stroke. Hot showers before bed also interfere with the natural cooling process that the body uses to prepare for deep sleep. Normally, your core temperature drops slightly at night, signaling the brain that it is time to rest. A hot shower reverses this process, artificially raising your temperature and disrupting your sleep cycle. Poor sleep itself has been linked to increased risk of hypertension, heart disease, and stroke. What many people dismiss as just trouble sleeping after a hot shower may actually be their body's warning sign of cardiovascular stress. Real-life examples make this clear. I recall a patient who had the habit of long, steaming showers late at night to soothe his back pain. He began to experience frequent episodes of dizziness and even collapsed once while drying himself. Tests revealed unstable blood pressure patterns and signs of mini-strokes. Once he changed his habit to earlier and shorter, lukewarm showers, his symptoms improved dramatically. The safe solution is to avoid very hot showers close to bedtime. If you prefer warmth, use moderately warm water. Keep the shower brief, and allow at least an hour for your body to cool before going to bed. This way, you enjoy comfort without putting your brain and heart at unnecessary risk. If this surprised you, wait until you hear about the next dangerous habit, showering immediately after meals, which can quietly disrupt circulation and raise the risk of stroke in ways most people never expect. Part 3. Showering immediately after meals. Another dangerous shower habit that many people overlook is taking a shower right after eating. It seems harmless, even convenient, to finish dinner and head straight to the bathroom for a refreshing wash before bed. But medically, this habit can quietly strain your circulation and raise your risk of stroke, especially if you are older or have underlying health problems. Here is why. After a meal, your body directs more blood flow to the digestive system to break down food and absorb nutrients. This is why you may feel sleepy or sluggish after eating. It is the body's natural way of prioritizing digestion. But if you take a shower immediately after a meal, the warm water dilates blood vessels in the skin and muscles, diverting circulation away from the stomach. The result is a competition for blood supply. Digestion slows down. The heart works harder to balance circulation, and the brain may temporarily receive less oxygen. For some people, this imbalance can trigger dizziness, nausea, or even fainting. In vulnerable patients, it can contribute to serious events like arrhythmias or strokes. The danger is greater at night. Your body is already preparing to rest. Blood pressure is naturally lower, and the shift in circulation caused by showering can push you into unsafe territory. For seniors with hypertension, diabetes, or narrowed arteries, this sudden change increases the chance of a clot forming or a vessel rupturing in the brain. Medical studies have confirmed that post-meal activities that divert circulation, such as intense exercise or hot bathing, can increase cardiovascular risk. One study found that older adults who bathed immediately after meals had significantly higher rates of dizziness, unstable blood pressure, and cardiac events compared to those who waited at least an hour. The mechanism is clear. Digestion needs steady blood flow, and interrupting it places stress on both the heart and the brain. I have seen this in my own practice. A patient in his late 60s told me he often showered right after dinner, thinking it would help him relax before bedtime. Over time, he began noticing frequent palpitations and lightheadedness, especially when stepping out of the shower. Eventually, he suffered a small stroke. His doctors explained that showering too soon after meals had repeatedly destabilized his circulation. Once he changed this routine, waiting at least 90 minutes after eating, his symptoms greatly improved, and no further strokes occurred. The safe solution is simple but powerful. Avoid showering immediately after meals. Give your body at least 1 to 2 hours to digest before stepping into the bathroom. This not only protects your brain and heart, but also supports healthier digestion and better sleep. If this surprised you, wait until you hear about the next dangerous shower habit: showering right after intense exercise. A common mistake that can quietly overload your heart and raise your stroke risk overnight. Part 4. Showering right after intense exercise. It may feel natural to jump straight into the shower after an intense workout. You are sweaty. Your muscles are hot. And a refreshing shower seems like the perfect way to cool down. But the truth is that showering immediately after vigorous exercise is another hidden danger that can quietly strain your heart and brain, raising your risk of stroke. Here is what happens inside the body. After intense exercise, your heart rate is elevated, your blood vessels are dilated, and your body temperature is significantly higher than normal. Your muscles are demanding increased blood flow, and your blood pressure may be fluctuating as your cardiovascular system works hard to restore balance. If you suddenly expose your body to water, whether cold or hot, you create a rapid and stressful shift in circulation. Cold water can cause sudden vasoconstriction, shocking the system and driving up blood pressure. Hot water can cause excessive vasodilation, dropping blood pressure too quickly. Both extremes place enormous stress on the cardiovascular system. And for older adults, this can trigger a stroke, heart attack, or collapse in the shower. Another overlooked problem is dehydration. Intense exercise often leaves the body low on fluids, especially if you have been sweating heavily. Dehydration thickens the blood, increases clotting risk, and makes the brain more vulnerable to reduced oxygen supply. When you combine dehydration with sudden temperature changes in the shower, the risk of clot formation or vessel rupture rises sharply. There are real-world cases that highlight this risk. I recall a patient in his 50s who ran every evening and immediately took long hot showers afterward. He began to experience dizziness, chest discomfort, and severe headaches after showering. Eventually, he suffered a minor stroke. Doctors found that his routine of showering right after running had repeatedly destabilized his circulation at the very moment his body was already under strain. By simply waiting 30 minutes to an hour after exercise, rehydrating first, and using lukewarm water, he could have reduced his risk dramatically. Research backs this up. Cardiologists note that post-exercise showers taken too quickly can interfere with the body's natural cooling process, increase oxidative stress, and worsen blood pressure instability. In older adults or those with hypertension, diabetes, or vascular disease, these shifts can become the final trigger for a vascular event. The safe solution is straightforward. After intense exercise, allow your body time to cool down gradually. Rehydrate with water, the light stretching, and wait at least 30 minutes before showering. When you do shower, avoid extremes of temperature. Use lukewarm water to support a gentle transition for your body back to its resting state. This protects not only your muscles, but also your brain and heart. If this surprised you, wait until you hear about the next dangerous shower habit: falling asleep with wet hair after a late shower. A seemingly harmless practice that can quietly harm your circulation and even raise your stroke risk. Part 5. falling asleep with wet hair after a late shower. One of the most underestimated shower habits is going to bed with wet hair after a late night shower. It may sound harmless. And many people, especially seniors, see it as convenient. Wash up before sleep and let the hair dry naturally overnight. But this practice can quietly increase risks to your brain and circulation, and in vulnerable individuals. It may even raise the chance of stroke. Here is why. When you go to bed with wet hair, the temperature of your scalp and the surrounding skin drops quickly. This cooling effect causes blood vessels in the head and neck to constrict. While this might not sound serious, for seniors with existing vascular stiffness or narrowed arteries, this constriction can reduce blood flow to the brain at a time when circulation is already lower during sleep. Poor oxygen supply to the brain overnight can contribute to headaches, dizziness, and in the worst cases, mini strokes. Another danger lies in prolonged exposure to coldness. As your scalp remains wet for hours, the nerves beneath the skin, including those connected to facial muscles, are exposed to chilling temperatures. Over time, this can trigger nerve spasms, leading to facial paralysis or chronic headaches. Patients sometimes wake up with half their face feeling numb or weak, mistakenly thinking it is just fatigue, when in fact it may be a warning sign of compromised blood circulation or even a transient ischemic attack. Sleeping with wet hair also creates an unhealthy environment for the respiratory system. The drop in body temperature combined with dampness can weaken immune defenses, making you more prone to colds, lung infections, or exacerbation of chronic conditions like asthma. For people with existing cardiovascular disease, these added stresses on the body increase the likelihood of vascular events, including stroke. During the night, I have seen this scenario in real patients. One elderly woman developed recurring morning headaches and facial stiffness. After careful questioning, we discovered that she often showered late at night and went to bed without drying her hair properly. Once she changed her habit showering earlier in the evening, drying her hair thoroughly, and keeping her head warm, her symptoms reduced significantly. The solution is simple, but essential. Never go to bed with wet hair. If you prefer showering at night, make sure to use a blow dryer on a low, gentle setting to fully dry your scalp and hair before lying down. Alternatively, shift your shower time earlier in the evening so your hair has time to air dry naturally before bed. Keeping your head warm with a towel or cap in cooler climates also helps maintain stable circulation. This may seem like a small detail, but small details add up to big differences in health. Your brain and heart depend on steady circulation, and protecting them requires removing unnecessary risks. If this surprised you, wait until you hear about the next dangerous shower habit: excessively long late-night showers, which may feel soothing but can quietly disturb your body's natural rhythms and increase your risk of stroke. Part 6. Long, late showers that disturb sleep cycles. Many people believe that taking a hot shower late at night is the ultimate form of relaxation. They think it washes away stress, calms the mind, and prepares the body for rest. But the truth is very different. Prolonged late-night showers can quietly disrupt your body's natural sleep cycle, strain your cardiovascular system, and in some cases raise your risk of stroke. Here is why. The human body is designed to follow a rhythm called the circadian cycle. As night falls, your body temperature naturally decreases, your heart rate slows, and your brain prepares for restorative sleep. When you take a long shower, especially with hot water, you reverse this process. The water raises your core temperature, dilates your blood vessels, and activates your cardiovascular system. Instead of winding down, your body is forced into a state of alertness. This disruption of the circadian rhythm not only causes difficulty falling asleep, but also leads to poor sleep quality. Studies show that poor sleep is strongly associated with high blood pressure, heart disease, and stroke. Another danger comes from spending too much time standing in a warm, steamy environment. Prolonged exposure to heat can lower blood pressure excessively, especially in older adults. This sudden drop can leave the brain without adequate oxygen, causing dizziness, fainting, or even collapse in the shower. For those with existing vascular problems, these blood pressure swings can become the trigger for a stroke. Long showers also increase dehydration risk. Steam and high heat cause you to lose fluids through sweating. Even if you do not notice it, dehydration thickens the blood and makes it more prone to clotting. A clot forming at night, when circulation naturally slows, is a serious risk factor for ischemic stroke. Patients who frequently complain of morning headaches, dry mouth, or lightheadedness after late showers may already be experiencing early warning signs. I recall a patient who had the habit of taking very long showers every night, sometimes lasting 30 minutes or more. He thought it was his way to relax before sleep. But over time, he developed insomnia, frequent night awakenings, and persistent morning fatigue. Eventually, he suffered a small stroke. His doctors concluded that his disrupted sleep cycle and repeated cardiovascular stress from prolonged hot showers had played a role. Once he limited his showers to 10 minutes, used lukewarm water, and showered earlier in the evening, his sleep and health improved. The safe solution is straightforward. Keep showers short, no longer than 10 to 15 minutes. Avoid showering right before bed. Instead, aim to shower earlier in the evening to allow your body to cool naturally before sleep. Use warm, not excessively hot, water to reduce cardiovascular strain. These simple steps protect your brain and heart and sleep quality all at once. If this surprised you, wait until you hear about the next part, who is most at risk from dangerous shower habits, and why certain groups must be especially cautious about when and how they shower. Part 7. Who is most at risk from dangerous shower habits? By now, you can see that showering at the wrong time, for too long, or at the wrong temperature can put unexpected stress on your body. But the truth is that not everyone carries the same level of risk. Certain groups of people are much more vulnerable to the dangers of late-night showers, and understanding who is at higher risk can help you or your loved ones avoid life-threatening complications. The first and most important group is older adults. As we age, blood vessels lose elasticity. Arteries become stiffer, and the heart no longer responds as quickly to sudden changes in blood pressure or temperature. A cold shower that causes sharp vasoconstriction or a hot shower that drops blood pressure might only be uncomfortable for a younger person. For a senior, those same changes can result in dizziness, fainting, or even a stroke. This is why seniors should be especially cautious about when and how they shower. The second group is individuals with high blood pressure or cardiovascular disease. These people already live with fragile circulation, and their brains depend on very stable blood flow to stay safe. Any sudden swing, whether from hot water dilating vessels or cold water constricting them, can destabilize their condition. I have seen patients with hypertension experience dangerous spikes or sudden collapses in blood pressure after a simple shower. For them, late-night bathing habits are not just risky, they can be deadly. The third group includes people with diabetes. Diabetes damages blood vessels and nerves, making circulation less efficient and less responsive. A sudden shift in body temperature from a shower can create serious stress on already compromised vessels. Furthermore, diabetics often have reduced sensation, meaning they may not notice early warning signs such as dizziness or numbness until the danger is severe. Another vulnerable group is those with respiratory conditions such as asthma or chronic obstructive pulmonary disease. A steamy hot shower can make breathing more difficult, while cold exposure can tighten airways. Both scenarios place added strain on the heart and brain. In individuals with both lung disease and cardiovascular risk, the combination of late-night showers and weakened circulation can significantly increase the chance of stroke. Finally, women may face unique risks. Recent studies suggest that women are more likely than men to experience sudden cardiac arrest at night, possibly due to hormonal and respiratory factors. When combined with unsafe shower habits, their risk may be amplified. For women with lung disease or those taking medications that affect breathing, showering late at night can be especially dangerous. The safe approach for all of these groups is prevention. Shower earlier in the evening. Use lukewarm water, keep the duration short, and always dry off thoroughly before bed. Avoid showering immediately after meals or exercise, and never go to sleep with wet hair. These small adjustments can dramatically reduce risk. Now that you know who is most vulnerable, let us move on to the final part, how to shower safely for brain and heart health. This section will give you clear, practical steps you can follow every day to protect yourself and your loved ones. Part 8. How to shower safely for brain and heart health. After hearing about the many hidden dangers of late-night showers, you may be wondering what the safe alternatives are. The good news is that protecting your brain and heart does not mean giving up showers. It simply means adjusting how and when you bathe to align with your body's natural rhythms and cardiovascular health. By making small but important changes, you can continue to enjoy the comfort of a shower while minimizing your stroke risk overnight. The first safe habit is timing. Try to shower earlier in the evening, ideally 2 to 3 hours before bed. This gives your body time to stabilize blood pressure, regulate core temperature, and prepare for restful sleep. Showering right before lying down leaves your circulation unstable and interferes with the natural cooling process that signals the brain it is time to rest. By moving your shower earlier, you protect your sleep cycle and reduce strain on your vessels. The second safe habit is temperature control. Avoid extremes of cold or hot water, especially at night. Instead, use lukewarm or moderately warm water, which keeps blood vessels stable and does not shock the body. If you want the calming effect of a warm shower, to make it brief and let your body cool down gradually afterward. If you enjoy cold water for refreshment, save it for daytime when your system is more alert and resilient. The third safe habit is duration. Keep showers short, around 10 to 15 minutes long. Steamy showers may feel soothing, but they can dehydrate you, lower your blood pressure excessively, and disrupt your sleep cycle. Shorter showers are not only safer, but also healthier for your skin and more environmentally friendly. The fourth safe habit is to avoid showering immediately after meals or intense exercise. After eating, your body needs blood for digestion, and a shower diverts circulation away from the stomach. After exercise, your heart is already working hard, and sudden temperature changes in the shower can destabilize your circulation. In both cases, waiting at least 30 to 90 minutes before showering allows your body to recover and reduces risk. The fifth safe habit is proper post-shower care. Always dry your hair and body thoroughly, and never go to bed with wet hair. This prevents chilling of the scalp, reduces risk of nerve spasms or headaches, and helps maintain stable circulation. In colder climates, wear warm clothing or use a towel to keep your body comfortable after showering. Finally, pay attention to warning signs. If you ever feel dizzy, lightheaded, or experience palpitations during or after a shower, take it seriously. These may be early signals that your circulation is under stress. Consult your doctor to evaluate your cardiovascular health and adjust your routine. By following these safe showering practices, you protect not just your comfort, but your long-term independence. Simple adjustments like timing, temperature, and duration can prevent dangerous swings in blood pressure, protect fragile vessels, and support healthier sleep. Now that we have covered the 6 dangerous shower habits and the safe alternatives, let us move to the conclusion, where I will tie everything together and remind you why changing these habits could save your life. Conclusion: why you must stop dangerous shower habits now. We have come to the end of this important discussion, and I want to leave you with one clear message. The way you shower is not just about comfort or hygiene. It can be a matter of life and death. As a brain doctor, I have seen firsthand how small daily habits, when ignored, quietly build up to devastating consequences. Stroke is often called the silent killer because it can strike suddenly, without warning, in the middle of the night. What shocks many people is that the trigger can be something as simple as a shower. We have uncovered 6 dangerous shower habits that put your brain and heart at risk. Cold showers late at night can cause sudden vessel constriction and dangerous blood pressure spikes. Very hot showers before bed may drop blood pressure too low, leading to dizziness, collapse, or unstable circulation. Showering immediately after meals diverts blood away from digestion and stresses both the heart and the brain. Jumping into the shower right after intense exercise destabilizes an already overworked cardiovascular system. Going to bed with wet hair causes chilling of the scalp, poor circulation, and even nerve spasms that can increase stroke risk. And finally, taking late showers disrupts your sleep cycle, dehydrates your body, and places ongoing strain on your vessels. Each of these habits might seem harmless in the moment, but together they reveal a pattern of risks that too many seniors ignore. The good news is that the solution is simple. Adjust your timing. Keep your showers short. Choose safe water temperatures, and never shower immediately after eating or exercise. Dry yourself completely and allow your body to stabilize before sleep. These small changes can dramatically reduce your risk of stroke and protect your independence. I want you to understand that your body still remembers how to heal. Even if you have practiced these habits for years, it is never too late to make a change. The brain is resilient. The heart is adaptable, and your vessels can recover when given the right conditions. Protecting your health does not always require expensive treatments or complicated routines. Sometimes it is as simple as rethinking the way you shower each night. Now, I would love to hear from you. Have you been guilty of any of these dangerous habits? Which one will you change starting tonight? Take a moment to reflect and share your answer in the comments. Type 1 if this video gave you valuable knowledge. Or type 0 if you want me to improve. Share this with someone you love. Because the life you save might not only be yours, but also theirs. And do not forget to like, share, and subscribe so you never miss another health tip made just for you. Remember, your health is in your hands. The way you shower tonight could make the difference between waking up refreshed tomorrow or facing a life-changing event. Choose wisely. Protect your brain. And give yourself the chance to live longer, stronger, and healthier.